Hello and welcome. And today I'm very pleased to introduce Geoff Rollason, who is a patient advocate but has a background in both the NHS and with pharmaceutical industry, which makes him a very interesting, I was going to say proposition, but it does make you a very interesting person, Geoff. Welcome.
Hello, Catriona. Good to be here. As you say, I'm Geoff Rollason. I worked in the NHS for around about 18, 19, 20 years. In various positions, I ended up as Associate Director of Primary Integrated Care in a trust in Warwickshire. On leaving the NHS during one of its many reorganisations, I went off to be a volunteer in Southeast Asia in a hospital there for about 15 months before returning to the UK to come back here to work for Pfizer. And for the last 8, 9, 10 years of my role with Pfizer, I was working very much in the area of patient experience. My final role was patient experience lead for Pfizer UK Oncology. And I had a responsibility for forming relationships with NHS organisations to develop projects which were aimed at improving the experience of patients receiving cancer services. We were tumour agnostic and the team was non-promotional, so we were able to work in areas where Pfizer didn't have a product, which made us quite an interesting proposition, in fact, to echo your words.
I suppose the thing is you straddle both sides of the equation, which, as I said before, is kind of unusual. And then now that you're obviously a patient yourself, which and we haven't actually discussed that, but I'm sure that we will get onto that. Does that make being an insider? Does your knowledge make that? Do you find you're more demanding as a patient, or are you more inclined to trust the system?
Yeah, very remiss of me. I forgot to mention that these days I'm also a prostate cancer patient, having been diagnosed within 2 weeks of my retirement date in 2025. In answer to your question, I think my background probably makes me more critical and less willing to put up with what I see as problems in the system, and more likely to be the person who's saying, "Okay, I want to raise a formal complaint," or "Okay, I want to speak to the manager," or "Why is this the way it is?" I'll give you for instance, a couple of weeks ago, I was trying to arrange a blood test to test my PSA levels just ahead of an upcoming review of my condition. And it took me in excess, and I know this because my Apple phone told me so, my iPhone told me so, it took me in excess of 70 redials to get through to arrange the blood test. And so I just raised a complaint immediately. And I feel I'm more likely to be the kind of critic, and maybe a harsher critic than some people would be these days. I understand the way the system works. I don't think there's many excuses for it working badly.
Mm. And then, as to, what's not working, and obviously you've put, as you said, you've done over 40 projects of embedding the sort of patient voice into oncology. What's the thing, do you still feel that industry just doesn't get right? And I don't want to put you in a compromising position, but I know that you feel fairly free in what you can say.
Yeah, in my opinion, that industry still talks the talk, but doesn't necessarily walk the walk. I was at a conference back in April in London where the whole idea of patient involvement and patient engagement was being discussed. And one of the delegates afterwards said to me, "Yeah, we've been talking about this for 15 years and not really done anything with it. We still talk about it, but we don't do it." And I genuinely feel that people want to engage patients, people want to involve patients, people want to be more patient centric and patient focused. But the driver from the kind of beast of industry is it's not towards patients, it's towards stockholder returns, it's towards Wall Street, it's towards profit for organisations, right? And the truth of it is, there's no great ROI, return on investment, in working with patients. It's it's a really long term piece of work to make working with patients work for the organisation. And so I think that the pharma
Mm.
industry really needs to look at itself and look at what it's trying to achieve. Healthcare, pharma industry, the whole point of those organisations is to improve the lot of people receiving their medication and receiving their services. And for me, that's not always the primary objective for pharma.
Yes, and I think that can also be seen in. Funny enough, I was sort of discussing the subject the other day about diseases that come with stigma behind them, and it seems to be the ones that have a stigma behind them. And I quoted both lung and liver. So people often think that if you've got lung cancer or liver cancer, it's because you've been smoking or drinking, which we know is not absolutely not necessarily the case. In fact, it was an oncologist that I was speaking to, and he was saying that those are the type of things that are so underfunded because of the stigma, and it's not attractive, which then goes through to shareholder benefit.
Absolutely, I think it's difficult, isn't it, for big pharma organisations? They invest millions, billions, probably in bringing new products to the market. It costs a lot of money. There's a whole lot of R&D. A whole lot of products will drop out. I think a few years ago it was something like for every 20 molecules, that began the process, only one would finally end up in market. And so there's obviously a lot of investment in there that's gone on, and organisations will naturally want to be able to um, make money back for their shareholders and make money back in order to reinvest in R&D and in developing new products. But at the same time, I think it's really important to me that industry doesn't forget what's happening to the people who are receiving the products that they've produced,
Mm.
and what the kind of experience of people is. What's their life like when they're taking a product which, in the case of, let's say, hormone therapy, produces crush and fatigue, meaning that people, men taking hormone therapy find it very difficult to function. It changes the body
Yeah.
shape. It changes the whole physiology of the person that's receiving the product. I was doing some rooting around for a presentation that I was doing, and because the idea of losing facial hair was something that I was interested in for a little while. And I was looking into it, and I found a guy who'd posted a comment on a prostate cancer notice board where he said something along, and I'll paraphrase, he said something along the lines of, "I haven't had to shave for 2 months. I have no hair under my arms. All of my body hair has vanished. I don't look like a man anymore." And his username was David is giving up. Now, I think there's a message in there about what that man was feeling about his self and his self image. I found another message from him around the same time where he was openly discussing committing suicide and saying he hadn't discussed it with his wife and his children because he didn't want to distress them. But he was having real problems coping with the hormone replacement therapy that he was getting. I haven't been able to find anything from him since. I don't know. I don't mean to infer that he has committed suicide, but I can't take the story any further forward than that. But this was clearly somebody who was very distressed by the whole, by this aspect, how he was changing as a
Mm.
consequence of a medication that, to all intents and purposes, is making him better, and is doubtless going to produce progression-free survival for this man with prostate cancer. But in other aspects of his life, it's destroying his self-image, it's destroying his confidence, it's destroying his will to live. I really think pharma needs to understand what's going on and to take some responsibility for what's happening.
Yes, I think it's that taking responsibility, and there's always that argument as who is responsible, which is a time-old one, isn't it? And funny enough that you should mention it, somebody in the village that I live in, her husband is going through some quite strong treatment for cancer, and she said he's a really strong man, and he's everything has been fine up until he suddenly started losing his hair, and that was it's like the thing that broke the camel's back. And she said that's just the thing that's really, really been a problem for him.
Yeah, and Katrina, it's going to be different for different men, isn't it? And different people, and
Mm,
different people in different therapy areas and the medication they receive and the side effects they feel. For me, losing my hair, losing my facial hair, losing my body hair doesn't bother me massively because I'm quite fair haired and I've never been massively hairy. For this guy, David is giving up. It was obviously a huge problem for him. I mean,
mm,
his view of himself was being altered, and there was nothing he could do about it other than feel despair and despondent. And so,
mm,
those kinds of changes which people experience as a consequence of just the impact of taking medication, um, it's important. It feels to me that it's something that's very important, and that from a very personal perspective, I'm I'm experiencing a lot of fatigue, and I find that very difficult. This time last year, I was getting up in the morning and walking 6K with my dogs before breakfast. I struggle to do 2,000 steps a day at the moment, and it's you know, for me that's quite important, and I'm feeling the impact of that, and yet, aside from filling in the yellow card that you talked about a few minutes ago, what's the answer for me? There's nothing. When I talk to oncologists about it, well, yes, it's a known side effect, and it's a known side effect, and so what?
mm,
What are you going to do about it?
yeah, yeah. It's a tricky one, isn't it? Um, the sort of moving on to the next sort of question that the Cancer Insights panel that you rolled out previously, etc. So stepping back from that, and obviously that gave lots of benefits to to industry, um, and charities and everyone getting involved. But where do you feel that the support is good, and where does the support then become less good?
So, in terms of the sorts of things that we produce from the Cancer Insights panel, um, I yeah, I've reflected on that a lot over the last little while. Um, we produced through the Insights panel a lot of data for Pfizer from patients, which they gave willingly. I'm not convinced that it was particularly well used. So I'm not sure there was a great benefit accruing from doing it in that sense. And interestingly, um, a few weeks ago, somebody who was on one of the Cancer Insights panels said to me, "So, what were the outcomes?" And I said, "Well, you will have had the final report when it was written up, which was shortly after I left Pfizer." And she said, "Yeah, I got the final report, but that's just a series of recommendations. So, what's actually happened as a consequence?" And it's a struggle. Bluntly, it's
Mm,
a struggle to point to anything that's changed significantly as a consequence of the work that went into it. I would, without seeking to make myself a martyr, I'd hold myself partly responsible for that, because I think when we were creating the panel, we got so excited by the idea of involving patients in the work that Pfizer was doing and in bringing people into Pfizer, we forgot to complete the loop with how do we feed back to people.
mhm,
Um, Additionally, in terms of how we embedded all the information that we got into the organization, what we didn't do well on reflection was engage more commercial colleagues in the panel itself from the get-go to get their buy-in, to get their kind of intellectual support, if you like, for what we were trying to achieve. And it became quite difficult once the panel had started to churn out information. It became quite difficult to make that information land within Pfizer, because the people we were telling it to couldn't see any relevance in it, because they weren't as steeped in the whole patient engagement, patient centricity world as we were. I'm not sure if I've answered your question there. So ask me again.
No, but I think you've actually answered my next question: is how would you change it and what would you improve? And I think that's kind of what you've actually answered. But that's always the way with anything, isn't it? Is getting people's buy-in at the very beginning, and that they come on. And I hate that word journey, but they do. They come on that journey with you. They understand why. It's why, and why is it so important? And you have to know that from the very beginning why it's so important.
Yes, and I don't think we really did that well enough. Added to which, I would say that, of course, people's roles in an organisation like Pfizer, the marketing people are incredibly busy. They've got their job to do, and that's what they do. And there isn't really the space or the headspace for people to come and spend half a day a week working on a project that may or may not ever come to any kind of fruition. So there's something there, I guess, about how the organisation resources new
Mm.
initiatives like that one. And I also think when you come down to it bluntly, um, carrot and stick. What are people actually bonused on at the end? And they're not necessarily bonused on how many patients we talk to over a period of time, or what level of information we get from those patients, which maybe is something that should be happening. So maybe if organisations like pharma organisations want to get involved with bringing patients in and using patient insight and patient experience properly, they should be thinking about how they remunerate their staff for doing exactly those things.
Yes, but then that seemed the one problem with that is that then just a tick box that you've just got people through your door, you've recorded a conversation, but you're still okay. What are you going to do with that conversation
Yeah, and I think
afterwards?
that's the crux of it, isn't it? If you simply leave it at we've brought people in and we've talked to them and here's a spreadsheet with lots of information on it, that means nothing. The real measure is what's changed as a consequence of what you did. What's changed as a
Mm.
consequence of that information that you got? What have you changed? Marketeers, what have you changed in what you do to better meet the needs of the patients that have been, the experiences that have become available to you to understand? What have you done, marketeer, to make that happen? What have you done, commercial organisation, to make that happen? What's changed in the organisation's strategy and operational direction as a consequence of that information coming into the organisation?
Mm. But I think quite often that is symptomatic of everything ends up being a project that has a life cycle, and after the 2 year, 3 year, whatever cycle that might be, you then go on to the next one. So people aren't necessarily learning and embedding the good things they've learned into the next one.
No, and that, as you say, that's the problem with treating it as a project rather than as business as usual. And the
Mm.
ambition would have been to take the insights panel, and as you mentioned, I think it has rolled out into other therapy areas within Pfizer. But I don't have the insight any longer of what's going on in the organisation. But the ambition would have been to make that kind of routine work with patients business as usual. So let's say let's say in prostate cancer, let's say that you know there's a panel in prostate cancer which is feeding its experiences through into the organisation, so that the marketers can think about how they structure their marketing, and the commercial organisation can think about what it does to support those people, and how can we support people with prostate cancer more effectively across the board, not just people receiving our product, but people receiving any product, and how can we be a real player in healthcare and not just a transactional one who hands over pills and takes money in exchange.
Mm. And I think you've answered my next question is looking ahead, what would you change? I think we've already said that. But one of the things, is going back to your role. I mean, you would now call yourself a patient advocate, I presume, because you go all over the world talking at various conferences. Do you think the things that we've just discussed today are things that these are the things that patient advocates, this is what they should be doing, the roles or the mantle that they should be taking up?
Personally, yes, I do. I mean, this is the route I've chosen to go down. Um, I I don't want to be harsh. I don't want to point the finger of blame at people. I don't want to say, "Oh, you're guilty. You should have done this. You should have done that." But I do think there's a gap between, very briefly, I think there's a gap between what healthcare services think they're doing for patients and what they ought to be doing for patients. And I think if the ambition, as I mentioned earlier, if the ambition of any organisation in healthcare is simply to think about how long do we keep people alive, then that's probably the wrong ambition, because it seems to me there's just looking at thinking of the things that I talked about just in the last few minutes, my own experience of other people I've talked to, there's a whole lot of quite unhappy people who are, if you like, just being kept alive. Their treatment, their therapies, their medications, their whatever is reducing their quality of life. It's not allowed. It's not letting them die, which is good, but it's not really taking into consideration what else is going on in their life and what could improve their experience and make them feel more whole and happier and more like the person they used to be before they were struck with whatever condition it is that they're dealing with. And that
Yeah.
to me is where services in general should, I think, pharma, healthcare services, healthcare tech, third sector. There's a whole big piece of work that could be done, system-wide work that could be done there. It's great, doing the stuff that we did was great. Doing projects here and there to change a breast cancer pathway or a urology oncology pathway, great stuff, really interesting work. But it's limited to a small area. It might be one hospital or one might have been one cancer network back in the day, and but there's a bigger piece of work that needs doing, I think, to change the focus and to change the whole system to really meet the needs of people, and not just the clinical needs of people, but the holistic, the whole life experience needs of people who are already in a difficult place and need help to move on. I just really quickly, I just had my second review, my 6 monthly review. Um, the review itself lasted 13 minutes. The previous review I had at 3 months lasted about 30 minutes. So in total, that's about 43 minutes of clinical input over a 6 month period. There are just under 4,500 hours in 6 months. It's not a great deal of clinical input going on there. People are out there managing and living with conditions the vast majority of the time with very little or no support, and that's where I see. I don't know what the something is, but something needs to be done in that space to help those people have better lives.
And I think also a lot of that can boil down to, there's the continuing conversation: is somebody a person or are they a patient? And
Yeah,
what you're talking about, and quite rightly, is the person.
yeah,
We're talking about a person,
yeah,
and your 45 minutes boil down to a whole 6 months of life of living with
yeah,
something to 45
yeah.
minutes.
Yeah, it's funny you say that. This morning, my wife was on the phone about a holiday that we had booked, and she was. My wife has various issues of her own, health issues of her own, and she happened to mention, "Oh, and you should know that my husband is a cancer patient." And when she came off the phone, I said, "I'm not a cancer patient. I'm living with cancer. I'm only a cancer patient when I'm talking to the nurse or the doctor. The rest of the time, I'm not a cancer patient. I'm just living with it." And that's you're absolutely right. People are people, and they're not a patient, because most of the time they're not seeing a clinician.
Well, Geoff, thank you so much for your time and being so honest and open about sharing your opinions about what worked and what didn't work. And especially, I think, saying the problems that you had, all the hard work, but still you can see the holes and the gaps, and sharing your own personal thing, which I think makes when you're living it yourself, takes a completely different perspective, doesn't it?
Certainly does. I thought I knew about being a person living with cancer until I actually became a person living with cancer. And then I realised I knew nothing before.